Today's episode is an Ask Me Anything. A couple weeks ago, I actually put out a question to my audience, my followers on Instagram. What questions do you have that you would like answered? And the response was massive. So I have compiled a good 15 or so questions that I'm going to answer on the podcast today. Some of them are personal questions. Some of them are questions asking for advice and a whole lot more. Okay, so you've got questions and I've got a lot of answers for you. So let's start off with the first question. What is a cosmetic procedure to reduce the appearance of spider veins? So spider veins are the tiny black squiggly lines that you can get. Typically people get it on their legs that for some people, they feel they look unsightly. Now, it's very important to really make sure that you separate spider veins from varicose veins. Varicose veins are puffy veins, veins that stick out, and those are treated very differently than spider veins, although both of them have to do with venous insufficiency. So how do you treat spider veins, these little black, tiny squiggly veins? There's a couple ways you can do it. The simplest way is that some people will inject it with a bit of saline. So you take a tiny needle and you inject saline into that spider vein, and it can actually kind of clear that vein out. Another way you can do it is to use lasers. Lasers can actually zap the tiny little blood vessels or the blood that is in that little blood vessel, the spider vein, and it can cause that spider vein to essentially disappear. Those are really the two simplest, easiest ways to get rid of spider veins. Varicose veins are a whole other story. Varicose veins are often treated surgically, sometimes non-surgically, and also looking at varicose veins, you want to look at the cause of them. So how do you prevent spider veins? Well, you can use compression socks, especially if you're in a job where you're standing up a lot. That's a great way to help prevent them from coming around. Number 2 is, at what age should I get Botox? Well, there is this idea called prejuvenation, and this is this idea that if you have Botox injections when you're young, it can prejuvenate your skin to prevent wrinkles from forming. And I do think that to an extent that is true, because the lines that Botox prevents are dynamic wrinkle lines. And these are lines that are caused by certain muscles in your face. And typically Botox, the 3 areas that we most commonly inject Botox are the crow's feet, the glabella or the frown lines between the eyebrows, and the horizontal forehead wrinkles. These wrinkles are all caused by muscles, and if you inject Botox into those muscles, it will prevent the transmission of nerve impulses to those muscles and cause those muscles to essentially relax, causing those wrinkles to smooth out. So some people are doing this prejuvenation where they inject Botox in somebody who's in their 20s, maybe even younger, in their late teens, as a way to prevent these lines from happening. And honestly, I am not a fan. Botox is a medical treatment. And why are we doing medical treatments on somebody who won't necessarily benefit from it? So that's the number one thing. When you're in your early 20s, there are no lines there, then you really are undergoing the risks of the treatment without really any benefit. Now, the risks of a Botox injection is quite small. You can get a bruise, you can get irritation from it, you can get a headache and stuff like that. But still, it is a true medical treatment. Even if it's performed by a board-certified dermatologist or plastic surgeon, there's still risks involved. And then the second thing that I worry is that some people, if they get Botox treatment after treatment, year after year, some people actually appear to get a resistance to the effects of that Botox. And so you may find that if you're doing a bunch of Botox when you don't need it, by the time you get into your 30s or 40s and you can actually potentially benefit from Botox, maybe it doesn't work for you anymore because you did it so much when you were younger when you didn't need it. And so that's another reason why I'm not a big fan of Botox. So what Botox on somebody who's really young? So what age should you get Botox? I would say when you start noticing wrinkles developing in those areas, once again, the forehead, the frown lines, the crow's feet, and those wrinkles are starting to really bother you, then that's when you would want to consult with at the office of a board-certified plastic surgeon or board-certified dermatologist and see if they feel that you're a good candidate for it. Next question. I've heard Leti can melt the tissue around your eyelids. Is that true? So can Leti cause fat loss around your eyes? The answer is yes. So Latisse is a prostaglandin analog, and the idea, it's made of a medication that has been used in glaucoma patients. And although it can cause the eyelashes to grow, you can actually also put it on your eyebrows, and even some people are putting it in their scalp for thinning hair. It has been shown to potentially cause the fat around the eyes to get thinner. You can get a hollowed appearance of the eyes. Now, this is due to the prostaglandin in it, and we don't really know the exact mechanism of action, but there are other prostaglandin analogs that are basically used to promote eyelash growth, and they do the same thing. It's not just Latisse. The problem is that most of the eyelash growth serums are prostaglandin analogs, at least the ones that seem to work really well. And so there is that potential side effect. Now, there's not a lot of studies on it, but the studies that I've seen does appear to show that if you stop the treatment, that volume typically does come back if you lose some of that volume. Honestly, one of the things that bothers me as I get older, and this is genetic, is I got puffiness under my eyes. And the thought has crossed my mind of applying Latisse as a way to reduce that puffiness. But I haven't done it yet, but that actually, if it is a side effect, could it potentially help people who've got too much fat there? Maybe. The only thing I worry about is that there's also fat of your cheek. And how do you know that it's going to go after the fat that you want it to? These are all things that we need to study. But really, in the end, if you've got, let's say, hollowing of your eyes and you're thinking about starting Latisse, then it may not be a good idea for you because it could potentially make the hollowing worse. And I tell you, if you've been following me on social media, if you've been using Latisse and you've got puffy under eyes like I do, and it's made it better, let me know because maybe I'll try it. All right. Next question. Were all the years of schooling worth it? So to become a board certified plastic surgeon, I'll tell you exactly what I had to do. I had to go through 12 years, of elementary, secondary education. So I graduated at the top of my class of high school. Now it was a small high school called Greenville in a tiny town in the middle of Michigan. And I was the top student. I had the highest GPA, I think, in the history of the school when I graduated way back in 1990. Then I went to college and I went to Kalamazoo College. That is a small liberal arts college in southern Michigan, and it probably is the number one academically, the small college in Michigan. University of Michigan is the number one university academically in Michigan, but Kalamazoo College probably the number one small college in Michigan. And there I had to graduate near the top of my class in order to get into medical school. So I did 4 years of undergrad. I graduated magna cum laude, which is basically I didn't have a 4-point, but I was pretty close to it. And then I went to 4 years of medical school at Michigan State University. So during the 4 years of medical school, you are taking exams, you're doing all the type of stuff. But to get into plastic surgery, I knew that I need to be at the top of my class in medical school as well. And so you have to take boards, you take exams. And I wasn't at the top of my medical school class, but I was in the top, I think, third or so. And I worked my tail off in medical school. So that's 4 years of medical school after 4 years of college. And then I did 3 years of general surgery residency training, where I worked essentially as a general surgeon, general surgery resident. Then I did 2 years of plastic surgery residency, and then I applied for a fellowship as well. And so to get into plastic surgery, you have to be at the top of your medical school class. And then to get the fellowship, I think there were 4 or 5 other plastic surgery residents that were applying for this exclusive Beverly Hills Plastic Surgery Fellowship. And I was fortunate enough to get that one as well. So I did then, 6 years total of plastic surgery, general plastic surgery residency training after medical school. So I don't know, what is that, 12 years plus 4, that's 16, plus another 4 is 20, plus another 6. So 26 years of schooling? Yeah. When I finished all of this, I was 30 years old. And that's when I started. So was all that schooling worth it? The answer is yes, because it got me exactly where I wanted to be. Now I'm a plastic surgeon. I've been in private practice for 20 years, and it's been a wild ride, but I wouldn't trade it for anything. Okay, next question. What's the best procedure for turkey neck without getting a facelift? So turkey neck is a term that we give to somebody who's got loose skin kind of hanging underneath their neck. And so really a facelift or a lower face and upper neck lift. We call it the lower face lift in my practice. That is a procedure to help get rid of that excess skin. But the negative of that is it's a big surgery. When I do it, it takes about 3.5 hours, and it does create permanent scars around the ears. And sometimes underneath the chin as well. So these are big operations, but they really do work. There really is no substitute for a facelift. So what can you do if you've got a turkey neck and you don't want to get a facelift? The problem is, as I said, there is no substitute for a true facelift. There are things that you can do that can make it a little bit better. So if you're, let's say, in your 40s or even 50s, and it's not quite a bad turkey neck yet, then there are things you can do like Morpheus 8, radio frequency microneedling. You can do ultherapy. You can even do fractional lasers. All of these treatments function to cause the collagen of the skin to essentially tighten or cause that skin to shrink a little bit. There's a new treatment that I mentioned in a podcast episode just a few episodes ago called Ellacor. Ellacor is a non-cutting facelift. And the idea is that it uses these hollow needles that go into your skin. They're attached to suction. And when those hollow needles go into your skin, they pull out a fraction of a millimeter every time of actual skin, a column of skin. And so the idea is if you've got this treatment that is putting these needles in your skin, let's say hundreds of times, you're removing, that tiny fraction of skin hundreds and hundreds of times. That can add up in a way to basically causing some of that skin to be removed. Now, I haven't seen the results being all that impressive yet, but the idea I think is a really good one where the pokes in the skin that's removed at such small amounts, it doesn't create a visible scar, but it adds up to eventually getting rid of skin. Now, if I do a lower facelift, I may remove 1 centimeter, even 2 centimeters of skin off of somebody, off their face on each side. The idea behind Ellacor is that you're now removing a fraction of that, but without the scarring. The idea behind, let's say, Morpheus 8, which is super popular in my office, that's a non-invasive skin tightening treatment, is that you're using heat to cause the collagen of the skin to tighten and essentially that skin to shrink down. And that will then improve an area like the underneath the neck. But the problem is that you have to expect that the results are going to be subtle. And so if you have a true turkey neck, if that skin is really hanging, then that treatment probably isn't going to do it for you. You got to consider surgery. So there's the answer. The best procedure for a turkey neck without getting a facelift, if it's not that bad, then I would recommend Morpheus 8. If it's more severe, really you got to consider the facelift. The Ellacor is an interesting thing. I don't think it's quite where I would like it to be yet, although I know some doctors are using it. Okay, anything that helps with dark spots on the face. So actually, if you've got a dark spot issue, I encourage you to see episode 26 of season 3 of this podcast. And that was a couple months ago. So episode 26, season 3, episode 26 of this podcast, where I covered all the options for hyperpigmentation, excess pigmentation. So definitely take a peek at that because I go into that in depth. A lot of options that you have. Question, do you do rhinoplasty? The answer is I used to. So I trained with one of the top rhinoplasty surgeons at the time in Beverly Hills. And I started my practice doing a lot of rhinoplasty surgeries. Rhinoplasty, basically, for those of you who are listening who don't know what it is, that's a nose job. So I did a lot of nose jobs. And honestly, I thought I was really good. I think I got really nice results. Almost universally, my patients were happy. Obviously, and if you do enough operations, somebody's not going to be happy. But I would say it was almost universal. My patients were happy. But I'll tell you, I was not a real aggressive rhinoplasty surgeon. So I made small tweaks with my patients, taking a bump off the nose, reducing the bulbous tip, things like that, where I could get a very defined change in their nose to give them hopefully exactly what they wanted, but keep them looking nice and natural. Occasionally, I would get patients who would come in to see me who wanted a massive change in their nose. That was not my style. And oftentimes I would refer them to different doctors. So I did rhinoplasty for 10 years. I just never liked doing them. Thought that they were tedious. And the thing I really didn't like, and I don't like about rhinoplasty surgery, is that there's a part of it and the results that are out of your control. So for example, if you get scar tissue after your operation and it literally creates a millimeter of scar tissue in the area, let's say where you take off the bump off the top of a nose, that can happen. It can happen just due to the patient's healing process, but you can see that from a normal speaking distance. Literally 1 millimeter of scar tissue or asymmetry can be seen from a normal speaking distance. And the operation can create things like that. Sometimes it's anticipated, sometimes it's not. And then a patient would be unhappy. And that's the worst part of it, is having parts of the operation that no matter how well you feel you did, may not turn out exactly the way you want them to. It's a very difficult surgery. Some surgeons relish the challenge of that operation. I didn't like it, honestly, because I like routine. I like doing the same operation over and over again, having a routine so the surgery goes super smoothly. I don't like being in the middle of an operation saying, gosh, what do I do now to try to get to where I want to be? This is a challenge. Not my thing. And some plastic surgeons, especially as they've been in practice for 20 years, they love that. They love the challenge. For me, I like surgeries that go so smoothly that you get what the patient wants, they're happy, and you move on. So I stopped doing it 10 years ago, and that's why it wasn't for me. Next question, what is your favorite movie, song, and color? So my favorite movie, I don't have one favorite movie, but I've got a couple. Now, growing up, I watched Grease probably 100 times, but that's an old movie. So something more recent, La La Land was one of my favorite all-time movies. Just love the story, love the music, just fantastic. Living out in LA for a year, it really made me very sentimental for my time out there. Otherwise, I love the Marvel movies. Infinity War, probably my favorite of all the Marvel movies, followed by Endgame, or you can maybe switch them out, but those two, some of my favorite movies. As far as song, I'm a huge Jimmy Buffett fan, and probably my favorite song would be One Particular Harbor. So if you are a Parrot Head, if you're a Jimmy Buffett fan, you know that song. That was my favorite one. Rest in peace, Jimmy. And my favorite color is probably blue. All right, what exactly is a holistic plastic surgeon? Well, this is a term that I came up with many years ago, and the idea behind it is plastic surgery that uses actual plastic surgery as a last resort. And what I mean by that is that there's so many things that you can do short of going under the knife to get the look that you want and it really, we focus a lot on that really in my latest book, Younger for Life. It's using the principles of autojuvenation to turn back the clock. So what does that entail? It entails what you eat, when you eat, nutritional supplements, skincare, and non-invasive treatments. And so by focusing on that, it's that principles of autojuvenation, turning back the clock naturally, using your body's own regenerative abilities. And really the idea of holistic plastic surgery is using that first. And if you cannot get where you want to be with that, if you've got a turkey neck, if you've got excess skin hanging from your tummy, if you've got skin hanging from your upper eyelids, those are things that you have to operate on if you're going to really change it. Then you can use that, but once again, as a last resort. And then if you do surgery, then you do it in the safest way possible, and you look at things like nutritional supplements that can help you heal faster, that can help you reduce your incidence of complications. It's not over-operating on people. It's not putting them under the knife for 10 hours for cosmetic procedures and then having them end up in the ICU. Yes, this type of thing happens. That is not holistic plastic surgery. So that is holistic plastic surgery. It is using actual plastic surgery as a last resort. And when you do operate, you operate in as safe a manner, as conservative a manner as possible to get the patient the result that they're looking for. What is the best way to increase collagen production? Ooh, that's a tough question. There are a lot of ways to increase production of collagen. So I don't know if there's one true best way. I think there's a lot of things to consider. So for example, if you are a woman who's postmenopausal, then hormone replacement therapy may be a great way to replenish the collagen of your skin. And there are studies showing that going on oral hormone replacement therapy can help to thicken the collagen of your skin if you're postmenopausal. So that's something orally you can take. That's a medication essentially. Supplement-wise, I'm a big fan of collagen supplements. And we have our Youn Beauty supplemental collagen that is our top seller across all the Youn Beauty spectrum of offers that we have, from skincare to supplements to sunscreen and all that. The number one selling is, no question, our supplemental collagen. So I do believe that collagen works. I can't tell you how many people have told me that they have seen such an improvement in their skin after taking our supplemental collagen for several months. And there are a lot of studies that show that that basically is true. As far as what you can apply to your skin to help with collagen, sunscreen, preventing that damage from happening, and sun exposure and UV damage is one of the prime reasons why our skin does lose collagen as we get older. But also applying things like retinol, like peptides, like bakuchiol. These are 3 ingredients that I think are great for helping to thicken the collagen of your skin. And then eating sufficient amounts of healthy protein. So food can make a big difference as well, because collagen is a protein, and if your body is not getting enough protein, it's not going to create enough collagen. So those are some things. I think that there's not one specific best way to increase collagen production. The best way is to target it from all these different manners, these different ways. All right, what's a small change or habit that can dramatically improve one's appearance? Ooh, I think one big one, honestly, is reducing stress. And how do you reduce stress? I would recommend meditation. Meditation doesn't mean that you sit with your, with your legs crossed, with your hands out, with your pinky sticking out, making the noise sound. It can be so many different things that you can do to meditate. But I strongly believe that meditation is a great way to reduce stress. It does impact the neurons in your brain in a very positive manner. And by reducing stress, you are going to slow down that aging process. You can relax facial muscles, so many things that it can do naturally to help to improve your appearance. If you want to know one treatment that can do that, because you say one small change or habit, that would be the habit I would recommend would be meditation and trying to meditate several days a week. Even if it's just 10 minutes at a time, you will notice big changes in your health and how you sleep and your stress level. And I believe in your appearance. But if I had to pick one treatment, then probably be Botox. Okay, do you recommend Kybella or M-Sculpt for removing face and neck fullness? So M-Sculpt does not improve the fullness of the face. So I would toss that one out. I actually have an M-Sculpt device. It's for strengthening muscles. And we are actually selling it because I don't know that we are getting quite the long-lasting results that we hoped to get when we first got the device and like the studies told us. So how do you reduce face and neck fullness? Kybella can be used in the submentum, which is a double chin area. So if you want to get rid of fullness down there, you can use Kybella. You can also use sculpture and you can use cool sculpting. These are ways to basically melt fat. I do think Kybella or liposuction is going to be more powerful at doing that than sculpture or cool sculpting. Those are going to be very modest changes in the fat underneath the chin, but you can really get big changes with Kybella and of course with lipo. As far as the facial fullness otherwise, there's not a lot of great treatments to reduce facial fullness. You can do a buccal fat removal. That's a surgery that removes fat from the inside of the cheeks. You can also inject Botox into the masseter muscles of the jawline. If you feel like your jaw is a bit wide and that's causing your face to look full, then Botox injections to that muscle can really help to narrow that jawline. But other than that, I'm not a big fan of liposuctioning the face. I do believe that can create a good amount of swelling and lumpiness, so I'm not a big fan of that. And so those other treatments are what I would in general recommend. Okay, I'm 59 years old and I cannot find a retinol that doesn't attack my face. Do you have suggestions? So there are different strengths of retinol out there. There are some retinols, like in my office, one of the skincare lines we carry is ZO Skin Health. Their retinols are potent. Some of them can be almost as potent as prescription strength tretinoin. So if you're using retinols like that and you can't tolerate it, then go for one that is not quite as potent and as strong. We have one in my Youn Beauty line, our Youn Beauty Retinol Moisturizer. For many years, it was our #1 selling product until our supplemental collagen came along. But I think it is a great cornerstone for somebody who wants to use a retinol, but they want one that is potent enough that you will see significant changes in your skin and you've got enough of that ingredient, but not so strong that you're going to have a ton of irritation, a lot of redness, a lot of flaking. And then the other thing you can do is using a retinol like that and not doing it every night, but maybe starting every 2 or 3 nights. It is definitely possible that if you haven't tolerated retinol very well in the past, you just haven't used it long enough, it can take 6 to 8 weeks or even longer for your skin to get used to the effects of retinol. And so giving your skin time to get used to the retinol, that can also help you if you to tolerate it. So kind of going slow, giving your skin time, and then using one like our Youn Beauty Retinol Moisturizer that may not be quite as potent as maybe the one that you're using. Okay, what is the safest and most effective way to get rid of belly fat? So belly fat comes in a couple of different types. There is subcutaneous fat, which is fat that's below the skin and above the muscle. This is fat that you can essentially pinch, but there's also visceral fat. Visceral fat is fat that's inside your abdominal cavity, fat that's around your inner organs like your intestines. And those types of fat can be treated very differently. If you're really interested in getting rid of belly fat, I strongly encourage you seek out Season 3, Episode 8 of this podcast. Season 3, Episode 8. That's how to flatten your tummy. I give both surgical and non-surgical options to get rid of belly fat. So check out Season 3 this season, but Episode 8, so that's several months ago. That should help give you the answers that you're looking for. What is the best handheld red light therapy device that you would recommend for the money? There's a lot of red light therapy devices out there. The one that I would start off with, if you're talking about a handheld device, is the Loom Box. The Loom Box has been created by a friend of mine, Dr. Vivian Chen, Youn. She is a holistic physician, and her Loom box is handheld. You can put it on a table. You can apply it to your face. You can put it on your chest. You can put it on your hands. I think it's very, very versatile. It's not super expensive. We will put a link in the caption of this podcast, or go to my Youn Beauty website, younbeauty.com. If you go to younbeauty.com and you basically scroll all the way down to the bottom, you'll see affiliates, and you should see a logo for Loom box, and that will give you a link to getting the Loom box with a discount as well. So if you want to try that, otherwise, if you're talking, so that was handheld, which is the question. I'm also a fan of red light therapy masks, and there's a number of them out there that I think are really good. There's one from iRestore, which I think is great. They actually normally do helmets for hair, but they actually have a great one called I think the Illumina mask. That one's a really good one. And then there's another one by Cure that's coming out that's really good too. And these have both red and blue light in them, so they're really versatile. So check those out. But if you're talking about handheld device, the Loom box is the one that we usually recommend. How was your med school experience like? So med school was tough. I went to Michigan State University. I spent 2 years in East Lansing, Michigan, and then 2 years in Grand Rapids, Michigan. And it was not easy. I actually went over a lot of med school in my book, In Stitches. This is my first book. And this is a memoir of basically growing up as an Asian American in the middle of Michigan and then going through college. And then the majority of the book is spent in medical school. So how do you take a kid and you turn them into a doctor 4 years later? I tell it in my first book, In Stitches. That's probably, I've had 4 books, and that was my first one. That one still, honestly, might be my favorite still. So if you haven't read it, definitely check it out. It's on Amazon. You can get it at Barnes & Noble online. It's not in most stores anymore because this came out way back, I think, in 2011. But I still think it's very relevant for today. All right, so final question is, what's your opinion on SkinViv for smile lines? So SkinViv is a new injection made by Juvederm. It's a filler, but it's more of a hydrator. And so it's injected in general in small quantities in the face to hydrate the skin, not necessarily to fill out specific lines like your smile lines. For the smile lines, I wouldn't do SkinViv. In general, there are other and the smile lines are otherwise known as the nasolabial folds. For that, I would look at different types of thicker fillers like Juvederm Ultra Plus. Restylane is good. Restylane Lift is good. There's a lot of other fillers, but I wouldn't necessarily pick SkinViv for that. So SkinViv I would use for more superficial hydrating, plumping of the skin. Final question, does going under anesthesia multiple times have long-term health effects? And this is a really good question. Lately I've had prospective patients come in for consultations for facelifts. I do a lot of facelifts, and some of the patients have been in their 80s. And I tell you, even though some of them are in great shape, my concern is that when you undergo anesthesia, you are getting chemicals pumped into your system. Some of them you're breathing in like nitrous gas. Some of them are being pumped in through your IV, different medications and sedatives and anesthetics. And my question, and we don't really know, I've talked to some anesthesiologists about this, and I think in the end we just don't know, is what is the impact of these medications, these chemicals on your brain long term? Is it possible if you're in your 80s and you're in great shape, your mind is functioning really, really well, that you undergo 4 hours, 6 hours, 8 hours of anesthesia, all these chemicals being pumped into your body? Is there any chance that that is going to increase your chances of really dementia type symptoms in the future? Of you getting brain fog, of your brain not functioning as well as you would like it to? And the answer is, I don't think we know. I don't think we know what impact that has. And so in general, and we talked about holistic plastic surgery earlier in this podcast, I'm all for limiting the surgery that you do because there are parts of it we don't know. If you think about undergoing plastic surgery and you ask me, Dr. Youn, if I have a tummy tuck or a facelift or breast implants, what's the worst thing that can happen to me? We have to start off with the fact that you could die from it. And if you are much older and you're undergoing a long operation, then that risk is going to be higher, and there are other types of things that can happen that we don't know about. And so really going back to holistic plastic surgery, making sure that you use actual plastic surgery as a last resort. So does going under anesthesia multiple times have long-term health effects? The answer to that question is we don't know, maybe. And because that's a maybe, then maybe try to avoid going under anesthesia multiple times if you can. So that was the Ask Me Anything. I hope you enjoyed my answers to your questions. We're going to have another one soon. We did have an Ask Me Anything episode done several weeks back. So if you enjoyed this, take a listen or a look at that episode. It was probably about 6 weeks ago that we aired it. Super popular one. We covered a lot of different subjects, from the favorite doctor that I beef with, my opinions on fat transfer to the breast, is a second rhinoplasty risky, how do you address if you're unhappy with surgery, estrogen creams, and a whole lot more. Take a look at that previous episode. Otherwise, once again, thank you so much, everybody, for watching, for listening. If you've been enjoying this podcast, if you could just leave a rating or review on iTunes or Spotify, wherever you get your podcasts, it definitely helps me spread the word. And as always, remember to eat real food, use clean skincare, and auto-rejuvenate before you operate.